Welcome back to The Factor Uncensored. Nearly 8 million adult Americans have attention deficit hyperactivity disorder, long-term there, most commonly known as ADHD. It is a neurodevelopmental disorder that can affect a person's ability to function or develop properly. The silent struggle impacts many adults' daily lives and productivity. Tonight on The Factor Uncensored, we have with us Dr. Judy Ho, a triple board certified and licensed clinical and forensic neuropsychologist and tenured associate professor at Pepperdine University. Glad to have you here, doctor. Now, first of all, let's establish what HDHD, that's too many HDHDs, but what ADHD is for the average person who may not be that familiar with it.
Of course. Well, ADHD is a condition that can have a few different manifestations. Most of what it's known for is attentional issues and focus issues, but also some people with ADHD could also have impulsiveness and hyperactivity issues. And so there's kind of different types of ADHD. Some are a combination of those symptoms. Some might just be someone who is struggling with attention and someone who's just struggling with hyperactivity and impulsivity.
Now, when we think about it, we tend to focus on children, younger people, but there is ADHD in adults out there. Tell us a little bit about that. And it's a lot of Americans dealing with it.
Right. So in America, somewhere between 6 to 10% of children under the age of 18 will be diagnosed with ADHD at some point during that time frame before they turn into adults. However, once somebody reaches adulthood, 50% of those childhood ADHD diagnoses will go on into adulthood. And also some people don't receive a diagnosis until they're adults. And so that usually comprises somewhere between 4 to 6% of the American population who have adult ADHD.
And for those who have failed to be diagnosed and they feel like something isn't right with them or a loved one or a family member or friend, how would you recommend breaking that? Like, can you go get tested? I mean, it's a sensitive subject if you tell someone you're not paying enough attention or you're all over the place. So how do you approach that with a family member or friend if you think they may have it or you may think you have it yourself?
Yeah, well, so first of all, have self-compassion and also compassion towards your family members. These struggles are difficult. As you just mentioned, there could be some stigma about it, maybe some embarrassment or shame. And also sometimes attentional issues or hyperactivity, impulsivity issues are also related to other conditions that might actually better explain what's going on, like depression or anxiety or some other kind of mental health concern. So we don't know until you see a right doctor, somebody who is specializing in diagnoses in an accurate way. And so the best thing that you can do is just take note of your own symptoms if it's you, or mention to your family member or friend, hey, I've noticed this about you. So talk about it in terms of observations, but don't act like the doctor. Don't diagnose yourself or them. Just suggest that maybe they want to go see a specialist to talk about this further. And usually it can start with a primary care physician because then they can refer you to a psychiatrist or a psychologist who does the testing to make sure that it's ADHD and not something else, because you want to make sure you're not missing something so you can get the right treatment.
I'm glad you brought up self-diagnosis because people on Google, it's a nightmare. Don't Google your symptoms. You will come up with anything. Now, when we're talking about individuals who are dealing with ADHD as an adult, what kinds of difficulties could they see down the road in their professional life and in their personal life?
Well, oftentimes adults with ADHD have found some way to almost disguise their issues, to try to work with it, but they may take on jobs that requires them to be in a lot of different places at once, because then that kind of keeps their interest and they don't have to sit down for a long period of time in front of a desk. If they do though, or if they have to be in a long meeting, you'll find that they might be fidgeting. It's harder for them to focus on the conversations. They might miss something, forget to take notes, and then have a hard time following through with a project they're supposed to finish. Oftentimes adults with ADHD can get very excited about projects in the beginning, but they have a harder time following through, executing all the steps, and staying interested through the process. Also, adults with ADHD, one of the biggest complaints that you hear is from their family members and their friends, and maybe sometimes their colleagues too, where they're saying, hey, it sounds like you don't seem like you want to listen to me, or you're not interested in what I'm saying. well, they care about you, but it's just that their minds are more likely to wander when you talk. And so then it seems like they're not paying attention and that it might be malicious, but it's not. They're really trying their best most of the time. ADHD adults also tend to do this thing called hyperfocusing. So when they find something that's interesting, they'll start to look at all the websites, they'll go down this whole crazy train, but they end up neglecting the things that they really need to be doing in the process. So that can actually hurt them sometimes at work.
Make sure you stay with us. We will be right back here on The Factor Uncensored. Dealing with ADHD is hard to do, especially if you don't know much about the disorder. Joining us to talk about how to be in a relationship with your friends, family, or loved ones with ADHD, here's neuropsychologist Dr. Judy Ho. And what if it becomes difficult on you as a family member or friend dealing with it? And I'll give you a perfect example. I have a friend who I think may have ADHD, but his situation is he'll go somewhere with me and he's ready to go in 5 minutes, exactly 5 minutes. He'll drive to my house nearly an hour, stay 10, 15 minutes and gone. So how do you deal with that person if they're close family or member or friend to you?
Well, that's a good example. And of course, sometimes that can wear on your patients. And I think and I think it's really important just to share with them, hey, this is something that I see is going on. It's disruptive to my schedule. It's kind of challenging for me. How can we problem solve this together? It's always really important to kind of bring yourselves to the table as a team, especially if it's somebody that you care about. So, hey, I've observed this. This is how it affects me. This is how it negatively affects me. How can we make this better for both of us? What's an easier way for us to do this? Can you make plans, stick to them? Can you actually follow through? If it's too stressful, just cancel. That's easier for me, right? Talk about the things that could actually work for you and for them. But I think it's really important, especially if you want a long-term relationship with this person, to be open to that communication, even if it's hard sometimes to do a confrontation. It's just important to solve that issue there, because I've treated patients who are saying, hey, I just started being very passive aggressive with this person and I cancel on them because I don't want to deal with it. And then, lo and behold, your relationship with them deteriorates. And so it's just important to talk about it, but still be on the same team when you're trying to come to a solution.
Now, when it comes to treatment for adults, are we talking about some type of medication? Are we talking about exercises? Are we talking about counseling? Or could it be all three?
Yeah, it could be all three. And I think that for most people, they'll find a combination that works for them. Some adults will take medication. There is a stimulant-based medication that's available, but also some that are non-stimulant oriented if you're worried about the potential side effects of stimulants. But medication is not the only answer. For many adults, they learn behavioral strategies to focus their attention better and to manage the difficulties that they have in their day-to-day life. So for a lot of adults, it's really about learning kind of almost like brain hacks to be able to focus a little bit better, concentrate so that you can finish projects, attend to people when they're speaking. It's almost like a physical training that you would do with a physical trainer, but it's for your mind. You can learn these kind of strategies. Anyone can learn them. They're evidence-based, and then you wouldn't need medication if that works for you.
All right. Dr. Judy Ho, and for those who would like to get in touch with you or learn more about you, or if there's a book you have that they can get, give us that information now.
Awesome. Well, you can find me on social at Dr. Judy Ho. Visit my website at drjudyho.com, where I give lots of free resources. And my newest book, The New Rules of Attachment, is out everywhere books are sold.